guys, so for the Q&A today, I thought I would address all of your questions about post-pregnancy hair loss. If you've ever dealt with this condition or, gone through it yourself, it is very, very real. And I can only imagine how incredibly distressing it must be. The idea of losing one's hair or the hair thinning is actually incredibly scary, and a scary thing to go through. Not to mention when you have a newborn baby at home. If you're new here, welcome. My name is Andrea. I'm a dermatologist, and I film day in the life of a dermatologist vlogs, as well as a weekly Q&A focused on a skincare topic that I get many questions about. So if this interests you and this topic is relevant to you, I encourage you to stick around. And with that, let's get started. So many new moms experience hair loss and thinning of the hair or hair falling out in clumps, usually a few months after having a baby. And as I said, this can be incredibly distressing. However, rest assured, it's actually a normal part of post-pregnancy adjustments that happen in the physiology of your hair biology. It's not permanent. It doesn't cause scarring, and the hair will eventually grow back. And it's frequently referred to as postpartum telogen effluvium, or hair shedding. Excessive shedding of hair after pregnancy is related to falling levels of estrogen. Like I said, the good news is that it's generally temporary. How long should I expect this to be going on? So for the most part, many women see their hair return to its full thickness and full growth, generally around the time of the first birthday of their child. But many women will regain fullness even earlier. So I get many questions regarding, ever since I had a baby several years ago, my hair has never quite entirely been the same thickness. What could be causing that? Or more persistent shedding? Well, in general, hair shedding peaks about 4 months after delivery. However, generally, if your hair does not stop shedding, or you feel that your hair never regains its fullness at the time of the first birthday of your child, it's a good idea to see a healthcare provider and or a dermatologist for evaluation and management, as there are a variety of medical conditions that could be contributing to persistent hair thinning and or persistent hair loss. These include things like low iron levels, low vitamin D, thyroid problems, and rarely autoimmune diseases as well. So if you note that this is going on for a prolonged period of time, I encourage you to see your healthcare provider to see if some blood work isn't indicated, or perhaps there is a medication that you are on that also might be contributing to the persistent hair loss, so that could be evaluated and potentially altered to help your hair. Another common related cause of persistent hair loss is changes in oral birth control pills, or going on and off different formulations of oral birth controls, particularly in mothers who are breastfeeding, maybe trying out a new birth control pill that doesn't affect breast milk production. And so starting and stopping different forms of oral birth control pills can further alter the hair cycle and contribute to persistent hair shedding. So that's probably one of the more common kind of overlying reasons why women continue to have bouts of hair shedding and never really quite getting back to their normal thickness as quickly as one would desire. But like I said, there are several medical conditions that can contribute to persistent hair shedding, or telogen effluvium, that should be evaluated. So people ask me a lot about, are there any vitamins or supplements that one should be taking for hair? If the hair thinning has persisted beyond a year, it's definitely most prudent to see your healthcare provider to make sure there's no underlying medical cause or vitamin deficiency or low vitamin level contributing, in which replacement would be indicated. But is there any need to take vitamin supplements to get the hair to come back faster? The answer is no. There's no evidence that any vitamin supplement will stop you from experiencing post-pregnancy telogen effluvium. However, it has been observed that oral supplementation with biotin, for whatever reason, can result in improvement in the rate at which hair growth returns and the thickness of the hair. So the next question that I get is, well, what is the recommended dose? And the short answer is we don't know. It hasn't been established. And some people have anecdotally reported a flare of acne on these, but that has not been reported in the medical literature. But supplements like biotin have a major limitation in that they are non-drugs, and therefore they are not regulated in terms of how they don't undergo the same regulation to have to demonstrate that they actually have the active ingredient in the amount that the bottle claims to have. So it's difficult for us to ever recommend a brand or a particular formula of biotin that will be helpful. And you know, the next question is, well, what about a multivitamin or some sort of specific supplement, or should I continue taking prenatal vitamins? That's certainly something to, again, discuss with your obstetrician or midwife or healthcare provider. But you know, taking a multivitamin is generally not associated with any harm and could potentially be beneficial, but there's really no supporting evidence to show that taking a multivitamin markedly alters the course of otherwise normal physiologic postpartum telogen effluvium or postpartum hair shedding. So I get a lot of questions about Rogaine for postpartum hair loss, or minoxidil. So if you're not familiar with this, the brand name here in the United States is Rogaine. It's 5% minoxidil is the active ingredient, and it can help increase the duration of time that hair is in the growing cycle. So the disclaimer is that there is a minimal amount of information about the use of topical minoxidil during pregnancy or during lactation. Meaning there's very, very little published information on use of this during pregnancy. So as a conservative measure, it's often recommended that women avoid using it while they're pregnant, simply because we don't know. Now, what about after delivery while you're breastfeeding? Is Rogaine safe to use? There are really few to no studies on the use of this during pregnancy or breastfeeding. So we're always very conservative to recommend things that are not medically necessary when we don't know if they could potentially be harmful. There is one case report in the medical literature of a 2-month postpartum woman taking oral minoxidil as a, I guess, blood pressure medication. Taking oral minoxidil, not the kind in Rogaine, but the actual pill form. And the metabolite of the oral systemic medication was detected in the breast milk at an hour after she ingested it. Beyond an hour, the levels fell from breast milk dramatically. Furthermore, the baby did not seem to sustain any adverse effects. There was no excessive hairiness of the baby noted. There's also no information to know if minoxidil applied to the surface of the skin has any effect on production of breast milk. So these are just very gray areas where we don't know enough to recommend solidly. So in other words, you may find some varying opinion on whether or not it's safe. So just talk about it with your healthcare provider and see what they think. But just know that there's really not a lot of data for minoxidil safety during or after pregnancy in the lactating woman who's breastfeeding their child. So what can you do in the meantime? Well, here are some tips. Sometimes using a shampoo marketed as volumizing can actually cosmetically improve the appearance of the thickness of your hair. Because what it does is it deposits protein-like ingredients on kind of the outside of your hair. It essentially makes a buildup, okay? And that makes your hair look thicker. but it's not actually altering the course of your hair growth in any manner. Likewise, avoid any shampoo that is marketed as conditioning, because these tend to be very, very heavy and weigh the strands down, and weighing the strands down makes them appear limp and thin and not so cosmetically desirable, so avoid those. And as far as conditioner, it likewise can weigh the hair down, so if you're using a conditioner, make sure it's very lightweight. And my tip is to only apply it, my tip is to apply it just to your hair tips. That's where the hair breaks most often. And where, conditioner can really shine, so to speak, really do some benefit, is actually on the tips, not up here where it's going to weigh the hair down. So that would be another tip, tip for your tips. And very importantly is avoid wearing the hair pulled back tight, as that can just contribute to hair breakage, as well as something called traction alopecia, which is just pulling on the hair chronically, putting the hair itself under a lot of stress. But to be honest, finding a shampoo and conditioner is really just a matter of trial and error. A single ingredient that makes one shampoo or conditioner better for finer hair, it simply doesn't exist. I mentioned avoiding tight hairstyles. One thing that I personally do is I never towel dry my hair with an actual terry cloth towel. As A, those tend to be pretty heavy, and B, the little loops on the terry cloth agitate the hair shaft and fray it and make the hair frizzy and also more susceptible to breaking. So, that would be another tip, is to avoid that. Avoid heat styling your hair, just wear it straight. You might even give a shorter haircut a try if you're open to it, because the shorter the hair, the less kind of breakage that can occur, and your hair can appear cosmetically fuller. One thing that no one has asked me about, but I will caution you new moms out there about, is something called a hair tourniquet. As you are shedding an increased amount of hair, which is physiologically normal after pregnancy, sometimes this hair falling out can land on your baby and get wrapped around their little baby fingers or toes. And it can wrap around pretty tightly. It's called a hair tourniquet. So keep your eyes out for that, as if you don't have enough to stay on top of. If you see this occurring, look for the loose ends and gently unwind the strand off your baby's finger. Sometimes you might not see the end, so you can use a little butter knife, just slip it up under the loops around the actual finger or toe. But if you can't physically remove it, but if you find that you cannot remove it, do see a healthcare provider for help. Because this could potentially compromise the circulation of the finger. So just keep your eye out for it. If you can't remove it yourself, then ask for help for sure. But like I said, hair falls out for many reasons. It's incredibly common and expected postpartum to lose hair loss. This should go back to normal at the time of your baby's first birth, as I said in the beginning, just to summarize. But if it doesn't, and if you continue to be bothered by it or continue to feel like your hair is not quite its fullness, then you should definitely, see your primary care provider and just make sure that your blood work and everything is back in place. Ask them to go over all of your medications with a fine-tooth comb, any supplements that you're taking. Herbal supplements are also very important to mention, to make sure that you aren't taking anything that in the medical literature may be reported to worsen hair loss. So those are all things to bring up right around the time your kid turns 1, if you're still dealing with this, to double check. Okay. So I hope this video was helpful to you new moms out there battling with the misfortune of postpartum hair loss. I hope these were helpful. Obviously, I don't have children and I've never experienced this myself, but I am incredibly empathetic towards that. But it can be incredibly scary to have your hair fall out. Many people have had bad dreams about losing their hair, and then to actually experience it, either in the normal setting of pregnancy or in the maybe related to something else. It can be incredibly distressing, and as a new mom, you have enough to to stay on top of and enough emotions and responsibilities to manage, to not be also trying to cope with the incredible distressing thought of losing your hair. So I hope this video was helpful to you guys. Give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you in my next Q&A. Bye.